which is actually, it is a very enigmatic disease. We do not know yet what is endometriosis, but we assume that what we actually see happening here is that we see that the same glands which are at the lining of the womb otherwise, so they are also present at places other than the lining of the womb. And then under the effect of hormones, they get active because they do have active receptors called estrogen and progesterone receptors. They are found to be anywhere in the body, at very, very odd places also sometimes, which is very rare. But in general, the most common place outside the lining is actually in the muscle of the womb and in the ovary. So when it is in the muscle of the womb, we call it adenomyosis, which is generally present in association with endometriosis. And endometriosis is actually a pelvic disease. So the lining of the whole tummy, that can have patches of those glands, and because of that regular activity, they look like as if the blood has collected. So for example, in the ovary, if there's a cyst, it looks like the blood is collected. Or query, we do not probably know what is the origin, but it is like a chocolate cyst when we actually take it out. So the commonest place of the focus of the endometriosis is the ovaries or the peritoneal lining or in the muscle of the womb, but it can be actually rarely seen to be present as far as lungs sometimes, very rarely. So that is, endometriosis is present in 10 to 15% up to, depending on the ethnicity and the local populations may have different numbers, but roughly around the percentage is pretty much significant. And March is an endometriosis awareness month. We're talking about that in this month. I'm glad. The second, and obviously, the symptomatologically, it is pain during sex, pain during bleeding, and pain during the passage of the stools. It is because of the scarring. So because of this activity, the organs or the tissues stick to each other, and this scarred or the adhesions nature of the pelvis causes pain, especially with the movement during sex, or passage of stools, or during the examination by a doctor. Typically, if the cervix is moved, it can really be very painful. And there is a very severe variety of endometriosis, which is called deep infiltrating endometriosis, DIE, D-I-E. And it is a very big challenge for the surgeon, definitely. The first surgery is the most important surgery because it's a chronic illness, it's a chronic disease, so it keeps coming back. But when we do it the first time, that means in the pelvis with the least amount of scarring. If we remove the focus of the endometriosis properly, then the repeat scarring is less. But if the first surgery is not done properly or less completely, then women sometimes undergo recurrent, repeated surgeries, because then the healing creates more scarring, and it's like a vicious circle happening.